All right, welcome everyone as we celebrate the week of the young child with this Lunch and Learn Echo titled Educate, Elevate, and Celebrate. Today is the first in our series of 5 webinars this week, and Kayla Livingston will be presenting on the CDC's Learn the Signs Act Early program. I am Kate Barlow, the CDC's Act Early Ambassador for the state of Massachusetts, and I will be today's host. Thank you all so much for joining, and Kayla, thank you for volunteering your time.
Hi, everyone. My name is Kayla Livingston. I am a third year doctorate of occupational therapy student at Mass General Hospital Institute for Health Professions, and I am the CDC Deputy Ambassador for Massachusetts Act Early. And today I'm going to be presenting on the Learn the Signs Act Early program. Let me get this out of the way. So today's presentation objectives overall, we're going to be recognizing that many children with developmental delays and disabilities are not identified as early as they could be. It will be important to understand the difference between developmental surveillance, developmental screening, as well as developmental monitoring, and the importance of all of these three things. We're going to identify how surveillance and screening together can improve early identification of developmental delays and learn to use the evidence-informed CDC Learn the Signs Act Early program with developmental milestones and all the other resources available through the program to support surveillance and screening. I wanted to start off with why are we monitoring development? Why is it important to monitor development? Developmental disabilities are common and they're often not identified before school age. Research is showing that 1 in 6 3 to 17 years of age children have a developmental disability, and 1 in 36 8-year-olds are estimated to have been diagnosed with autism spectrum disorder. So overall, research is showing developmental disabilities are even more common among children from low-income households, with 1 in 5 children experiencing a developmental disability. We're first going to talk about developmental surveillance, developmental screening and monitoring, and how that coincides in facilitating early identification of children with developmental delays and disabilities. This is a diagram showing how developmental monitoring and screening are both similar and different from each other. It's important to understand the differences between the two. Developmental monitoring is observing a child in their natural environment, so observing how they're playing with others, how they're interacting with other children, how they speak, how they move. It's an ongoing process that begins at birth through observation, and it can be done by anyone. It can be done by parents, by family members, teachers, health professionals. An example of developmental monitoring is the Learn the Signs Act Early Milestone Checklist, which we will go into further later in the presentation. And then on the other hand, developmental screening is a more formal process. It cannot be done by anyone. It's done by health professionals or by someone such as a teacher with special training, and it uses a validated screening tool, and it helps to determine if children's development is on track and whether they need to be referred for further evaluation. So this is not diagnostic, but again, it helps to determine if evaluation is needed, and it may sometimes be used to qualify for some states' early intervention programs. The American Academy of Pediatrics recommends developmental screening at certain time frames in a child's development. So at 9 months, 18 months, and 30 months, developmental screening is recommended for general development. And then at 18 months and 24 months, screening is recommended for autism. And it can be completed at other times as well, such as if a parent has a concern or if there was a missed appointment, developmental screening could occur then as well. Together, both developmental monitoring and screening should be done for all young children. It looks at they both are looking at developmental milestones, and they're very important in tracking signs of development and identifying concerns. Research has shown that when developmental monitoring and screening are done together, more kids are being referred to early intervention services compared to when developmental monitoring or screening are done separate. The research is supporting using both of them together. Then we have developmental surveillance, which is more than just looking at milestones. It's continuous developmental monitoring that is performed by a healthcare provider, usually the child's pediatrician, at every well child visit. Therefore, it's an important way for healthcare providers to identify children at risk for developmental delay. So developmental screening can supplement and strengthen ongoing surveillance for developmental delays that parents or providers might not see during these routine surveillance interactions. I also wanted to note that surveillance is not the same as screening, and screening is not a diagnosis, although the two of them together, they do complement each other, and they can together improve early identification of a child with developmental delay or disability. There are 6 components to developmental surveillance that the pediatrician goes through at every well child visit. So they'll review milestone checklists and developmental history with the family. They will ask if the family has or caregivers have any concerns about the child. They will assess the strengths as well as risks for the child and observe the child, so that that includes developmental monitoring of milestones. They will then document these findings, and these results can be shared with other members of the child's team, such as early child educators or home visitors or anyone who's really involved in the child's care. This is a schedule of the child well visits, showing from birth to 5 years old when screening is recommended. So the highlighted months are when developmental screening occurs, as I was saying before. 9 months, 18 months, and 30 months are when the child is due for developmental screening with their healthcare provider, and then 18 and 24 months for the autism screen. And I just wanted to show this visual to note that children are not being screened after 2.5 years old, which is where I also think developmental monitoring comes to be really important, as they're not receiving that developmental screening routinely after 2.5 years old. So that's when, if there's a concern, it can be brought up to the pediatrician for screening to occur. So early intervention is better. Early childhood, as we most might know, is period from birth to age 3. And this is a really critical time period for brain development because the neural circuits are the most adaptable for learning at this time. And the evidence supports that the earlier a child is identified to have a developmental delay or disability, then the sooner interventions and family supports can start, and the sooner that child is receiving the services. And these interventions and supports can help a child's skills, their abilities, future school performances, their self-care skills, etc. And other benefits of early identification could be that these interventions also allow the family to better understand their child and their child's strengths, and then areas that their child may need more support in to better promote their development at home. And it's always important to know that it's never too late to start services and supports. This is a helpful visual showing the importance of developmental surveillance and parent-engaged developmental monitoring within broad systems. So as you can see here, early intervention may be accessed after surveillance or developmental screening steps, but it's important to note that entering early intervention services as soon as possible, so maybe going from just surveillance to Early intervention services can help reduce wait time to intervention services. And then family engaged or parent engaged monitoring is a part of surveillance, and it's a big part of this continuous approach. So when we're monitoring, if we have a concern, then we're going to have the child screened. If there's a concern, once the child is screened, we'll next ask for the child to be evaluated, where an evaluation will then determine if the child needs services and supports or not. Okay, I'm going to move into talking about the CDC Learn the Signs, Act Early program. And so this is a program to improve early identification of developmental delays and disabilities, including autism spectrum disorder, by facilitating parent-engaged developmental monitoring, as well as promoting developmental screening through children and their families, and so that these families can get the services and supports they need for their child. The program does this through different health education campaigns, through ACT Early ambassadors, through research and evaluation. They offer free resources and materials such as developmental monitoring checklists and other tools to help make developmental monitoring practical and easy for both health professional staff as well as families. The ACT Early Ambassador program includes representation most US states and many territories. And it's just a broad program that partners with healthcare settings, women and infants and children nutrition programs, Head Start and early Head Start programs, and others working with children birth to 5 years old. So why are we wanting to use Learn the Signs Act Early program? Most parents are noting concerns about their children around 18 months, yet most children are not diagnosed with autism spectrum disorder until they are at the age of 4. And more than half of children with delays miss the opportunity provided by early intervention services before the age of 3. So Learn the Signs Act Early can really help to bridge this gap between when concerns are noted and when a child is identified with a developmental delay or disability, and help them receive the services that they need early on. Learn the Signs Act Early is prepared to target a variety of different audience members, doing this through the Act Early ambassador for each state and the deputy ambassadors, so serving parents and caregivers of young children, child healthcare providers such as pediatricians, early education and care providers such as Head Start or early Head Start staff, as well as providers working in family services. So for my role is to help everyone get on the same page, start using consistent language to promote developmental monitoring and to promote these free materials and resources available through the Learn the Signs Act Early program to help more children be identified as quicker or as early as possible. So as I was saying before, the CDC Learn the Signs Act Early program offers a wide variety of free resources that are designed for parent engagement, and they have been recently updated to reflect the updated milestones that were released in 2022. So all the images I have on the following slides and resources on the website now are updated to reflect the milestones that were released in 2022, and I'll go into more of that later in the presentation as well. But one of the big resources through this program is the milestone checklist. So these are checklists available on the website that can be downloaded or printed in English or Spanish. Some are available in other languages as well, such as French, Vietnamese, Chinese, etc., which you can find on the website as well. And the checklists focus on a specific age, and there we have checklists from 2 months to 5 years old. And there's approximately 13 milestones per checklist, and they are categorized into 4 different categories. So you have social emotional milestones, language communication milestones, you have cognitive milestones, so the learning, thinking, problem solving skills, as well as movement and physical development milestones. And each of these milestones are what most babies are doing at that age. So at or greater than 75% of children should be hitting these milestones at that age per the checklist. When you're filling these checklists out, the answer choices are yes, not sure, or no, not yet. And if you or a parent are not sure whether a child is hitting any of these milestones, it's recommended to watch these milestones over the next week or two. Try to do some activities with the child that gives him or her the opportunity or the chance to show that milestone. And then if you're still not seeing it, then it's time to act early. So if a child doesn't hit one or more of these milestones, it's time to act early. And so at the bottom of the checklist, there in the blue box, you know your baby best. There's information on what to do to act early. There's referral and EI intervention resources to facilitate what to do when they are missing a milestone. And so there's also the other important things to share with the doctor, which are just some open-ended questions that you can talk to parents about with to help give you a better idea of the child, maybe at home, or encourage parents to discuss these questions with their doctor as well. Just hoping to give a better idea, overall picture of the child that's not just milestones. And then on the back, so the third picture here on this screen is the back of every checklist, which will have different tips and activities to do with the child, either for parents at home or for you during the day in your setting. All of the checklists will include that as well. And then another nice feature of the checklist is that, so if you look at the child at 18 months checklist, it has it's time for developmental screening note. So at every developmental screening age, the checklist will include a reminder that there is developmental screening to occur at this age, and it aligns up perfectly with the well child visit that we went over earlier. Oh, I think it's also important with these checklists, they're a really good facilitation to conversation, whether you're filling it out and then going to be discussing milestones with a parent or family. They're a really great resource to use when talking to families, and also a really great resource for families to use when talking to their child's doctor to make sure that all the information is getting relayed to the pediatrician. We also have the CDC Milestone Tracker app. This is available in English and Spanish as well. You can download it for free on your phone, Apple, Android, or a tablet. It's easy to use. There's no ads. And it's basically a digital milestone checklist. It helps parents as well as early care and education providers track a child's milestones from age 2 months to 5 years. So it has the same milestone content as the checklist, and you can use this app to digitally track a child's milestones. You can quickly reference milestones by age and category, as well as find out what to do if you are concerned about a child's development, all through this app. Some other features of the app. So as you can see, you can create a profile like for Jaden here. You can personalize checklists for multiple children, so you can have more than one child profile on the app. You'll just like go in and click whichever child you're looking to go into. You can get tips and activities to support a child's development. You can get notices through the app for when it's time to act early, or maybe for when it's time to talk to parents or families about developmental concerns for a child. The app produces a milestone summaries, and this is a great resource to share with a parent or another important care provider. There's also interactive milestone checklists. So this means that the milestone checklist will include photos or videos of each milestone, which can be really helpful when talking to parents, being able to show them a picture or a video of the milestone that you're referring to so that it can help ensure their understanding. There's also a resources tab, a tab for when to act early. So you can, when you hit when to act early, it asks you a few different questions. And if you select any of those items, then it's important to act early. There's also the add appointment tab. And so families can add upcoming recommended doctor's appointments or well child visits, or you can add an appointment for a reminder when to complete a checklist for a child or when to talk to a family. So there's a lot of great resources digitally on this app. The Milestone Moments booklet is another great resource that the CDC Learn to Science Act Early program offers. I believe it's like 42 pages. So it's kind of meant to be kept over time and used over time. And it has all of the checklists from 2 months to 5 years of age in this booklet in one place, which is great. There's a section of what to do if you're concerned about a child's development. And then there's also the child's developmental tracker, which is just kind of an organized way to keep track of a child's development over time. So keeping track of when they're receiving developmental screening and what occurred at that time, what screening tool they used and the results of it. And then there's also a section for questions for my child's doctor. So any questions that you have at any specific age, it's kind of just a great way to keep everything in one place. So you're not, maybe instead of having to like print a checklist every time, if you have a booklet for each child or a family has a booklet for their child, they can use it throughout the child's development. This slide just shows pictures of all the different, or not all, but most of the free materials that are offered through the Learn to Science Act Early program. These are a lot of things that you can download to your computer or print out. There's milestone brochures. So the brochures highlight a few key milestones for a variety of ages. It provides an introduction of developmental monitoring and acting early. So these could be great resources to have in a classroom or in the lobby or to hand out to parents as a developmental monitoring resource. Same thing as the growth chart, which you can see on the left. It's just an engaging poster display that could be hung in a classroom, for example, and a reminder to watch for and record both physical and developmental growth. There's also tip sheets, and the tip sheets you can download or print from the website as well. They are targeted to specific audiences. So there's tip sheets for people going into homes, seeing children. There's tip sheets for Head Start and early Head Start staff, as well as early care and education programs and WIC programs. There's tip sheets for developmental monitoring and screening. So what are the differences between the two and why are they important, which could be a really great resource to hand out to staff or to families. There's also tip sheets on how to talk to a doctor, which could be great to hand to families, how to help your child as well. And then there's also tips for talking with parents about developmental concerns. So, I mean, those conversations can be hard sometimes, and there's resources and tip sheets here to help facilitate those conversations. The website also has children's books, and these there's 3 of them. So you have Baby's Busy Day, which is for 1-year-old milestones. It goes through and highlights milestones for 1-year-old and provides tips and informations about what to do to act early on these concerns. Same thing for um, Where is Bear, which is for 2-year-olds, as well as Amazing Me, which is for 3-year-old milestones. And so these books again are offered in English and Spanish, and they can be ordered for free on the CDC website under orders. So all of the materials that are offered through this program are research-based, they're easy to understand, they're parent tested and reproducible. And so materials such as the checklists or tip sheets, resources like that can just be printed from your laptop, or you can download them and have them on your laptop or tablet. But then the other materials like the children's books or milestone moment booklets, or brochures, materials like that, you can order from the website at this link, and they'll ship them for free to your house. But they will only give a very limited supply. So kind of like whatever they have in supply currently when you go to order. For example, you maybe can only order 5 books of Where's Bear or 3 books of the Milestone Moments booklet. So that's something to consider, but also you can pay for your own printing, and then you can customize and put your logo on them and print them that way. You would just have to pay for the printing, but could maybe do like a national printing chain or something and order them in bulk to help reduce cost. But there's a lot of different options on ordering your free materials or downloading them or printing them. So I'm gonna go into a little bit about the milestone revisions that came out in 2022. I noted it a little bit earlier, but these milestones were revised to incorporate feedback from more than 15 years of use of the program. So as I noted before, when we were talking about the milestones on the checklist, those milestones included are for when most children are expected to achieve by given ages. So most children is at or greater than 75% of children will achieve this milestone scale at this age. And so this approach helps to ensure that any milestone a child misses on a checklist is cause for discussion and action to be taken, such as in-depth surveillance. So this revision is helping to avoid that wait and see approach by making it clear of when there is a concern and what to do. So this is in contrast to many milestone lists that often use average, so 50% of skills that half of children wouldn't be doing by the given age. And so the revised milestones included in this revision, they added the 15 and 30-month checklist. This was to match, and this matches the well child visit schedule. So that was added. And also they eliminated vague language such as may or begins, and no longer includes different warning signs. On the checklist, the prior checklist included warning signs, what could often cause some confusion. But overall, these revisions will help to avoid common questions like how many milestones can be missing without being concerned, because now we know as if there's one or more missing, then we're acting early, or it's helping to avoid questions like, are the warning signs important? So it's just eliminating any unnecessary worry and avoiding that wait and see approach. The results of the process, of this revision process, were that there was a 26% reduction in total milestones. So there were originally 216 milestones and they reduced them to 159, sorry. And so 25 duplicates were removed, and the average milestone per checklist was reduced from 23 to approximately 13 milestones per checklist. 60% of the milestones were retained from the original. So there were 94 milestones that were retained and 65 new ones. The majority of the milestones that were retained, they did stay at the same age. I also wanted to note that it was noted from throughout the process from the evidence review team that normative data was somewhat difficult to find because references for typical developmental milestone tables are not usually cited, or they cite each other. So 80% of the final milestones had normative data from at least one source. It was also noted throughout the process from the evidence review team that evidence for social, emotional, and cognitive milestones were particularly hard to find. So the milestone revision process took place and was completed in 2019. So then the additional program materials were revised, and after the milestones themselves were revised, so the final publication, as well as the new materials, were released in early 2022. And if you would like any more detailed information about the revisions, you can use this website, Evidence-Informed Milestones for Developmental Surveillance Tools. So all these materials that we've discussed in the Learn the Signs Act Early program are relatable and accessible. They were written in family-friendly language, so they were written in a 5th to 7th grade reading level. They all include milestones that are observable in natural settings, making it easy to see your child complete these or demonstrate these milestones. There was cognitive testing milestones done with families, so they were tested for their understanding of the milestones from a diverse background of families. And again, these resources are all free and accessible through a variety of formats, as we discussed: paper copies, online downloading version through the app, ordering the materials, and available in multiple languages as well. Always in English and Spanish, and other opportunities for other languages, mainly in a lot of the checklists offer other languages and some of the other resources as well. So that can be found on the website. I did want to note some checklist limitations. It's important to remember and know that the CDC surveillance tools are not developmental screeners, and they are not a validated screening tool. When developmental screening is completed, there's a validated screening tool used, but with this program and these checklists, we're doing developmental monitoring. So again, these checklists don't change developmental screening or evaluation tools. And also important to note that they should not be used to qualify for or discontinue services, and they are not inclusive of all potential milestones as well. So some tips from healthcare professionals. I think it's really important when working with families to build that trusting relationship with them and build strong rapport with them, especially when we're discussing results of surveillance and screening tools, even if it's not concerning. The conversation is easily approached and more understood when you have a strong relationship with the family and they feel as if they can trust you and they feel comfortable in sharing their concerns and asking questions and things like that. Also, taking a strength-based approach. So it's really important to also talk about all the positives and strengths that the child has and is doing every day. So talking about those first and then going in to discuss any concerns if you have any. I think it's also important to remember that you're working with the family together as a team, and through this shared decision making is how we're going to be able to provide the best possible care for a child with both and all members of the team being on the same page and making decisions together. Then again, the materials can support a strong family engagement through the checklist and through the family-friendly referral guides and tip sheets, etc. Can really support family use of them at home. And then closing the loop after referrals have been made. So I think it's important to track developmental referrals and support families while navigating the referral process and just provide support for them throughout. It doesn't just stop once they are referred. So when asking for help, if you have concerns, it's important to always suggest to parents to talk to their child's primary healthcare provider. Families can also contact Family Ties directly or early intervention and special education at their local public school. Family Ties is a parent advocacy group for Massachusetts that provides resources, classes, and groups or trainings, respite care, important referral services information to parents of children and youth with special needs. And so Family Ties acts as the statewide directory for early intervention services in Massachusetts. So directing families to this website or to calling this number, they are the Family Ties staff can help direct them where to go depending on the child's age. When there are developmental concerns, families should be referred to their child's healthcare provider, so their pediatrician and or their local early intervention system and or special education and or Family Ties. Family Ties can then refer to early intervention or special education. So these are all these options in dark blue are where families can be directed after asking for help. If a child is flagged for or with concerns from the screening process, then the child is going to be referred for an evaluation. And so the evaluation may be for early intervention for a child birth to 3 to assess all areas of development, or it could be for a specific service, such as a hearing or vision evaluation. So this could happen if, for example, a child wasn't reaching for toys. That might be because the child has a vision deficit, or maybe the child isn't making signs and they need a hearing evaluation. And then also sometimes if a child is having, usually with older children, with sensory processing difficulties, then the child might be referred for an outpatient occupational therapy evaluation. So where they go once they ask for help and going to get a referral is really child specific, but all the evaluations are completed by healthcare professionals who are licensed in the state. So I know that we all probably know a lot about early intervention and special education services, but I just really wanted to highlight that the early intervention federally funded state provided birth to 3 years old program is completely free in Massachusetts. It's not free in all states, but in Massachusetts, early intervention services are free. And then with special education services, I wanted to note that for children 3 years to 21 that they do need to have a diagnosis in order to receive this specially designed instruction to access the general curriculum through special education services. I also want to touch on that research shows that 60% of children in early intervention will be eligible for special education in the public schools. But in Massachusetts, only 40% of children in early intervention will be eligible for special education in the public schools. So we don't have or I don't have the research to support this. I've just heard this through verbally through those working in this setting. But the reason why only 40% of students in Massachusetts are eligible for special education services is because Massachusetts does such a good job in finding so many children eligible. We have one of the most lenient eligibility criteria, and because the eligibility criteria is determined by the states for early intervention, in some states it's a lot more difficult to find children eligible. But since we do have that big eligibility criteria, it's easier for Massachusetts to find kids eligible for services. But then when we move into special education, it's federal requirements. So I wanted to highlight parents know their children best, and you have the opportunity to create strong bonds and good rapport and relationships with them. So sometimes parents may report that their child's doctor was not responsive to their concerns about their child's development, or maybe their doctor suggested a wait and see approach that the family is feeling uneasy about, and they're expressing this to you. I think it's important to just remind the parents and family that acting early on concerns is the best way to help their child, and that they're doing and taking all the steps that they should be. And that, again, they know their child better than anyone, and no one is going to give services to a child who doesn't need them. So I think overall, a big takeaway message is just, when in doubt, check it out. Which leads to, are you currently using Learn the Signs, Act Early in your setting, or are you implementing developmental monitoring in your setting right now? And if not, a really great resource is the Watch Me training. So this is a resource part of the Learn the Signs CDC, Learn the Signs, Act Early. It's a free online continuing education model. It takes approximately, I think it approximately takes 45 to 60 minutes, give or take, depending. I think mine took like around 60 or more, just because I was stopping videos to take notes. But overall, it doesn't take very long, and it teaches you how to use developmental monitoring in a birth to 5 childcare setting. So it's training specifically for early care and education providers, and it provides tools and best practices for monitoring the development of children in your care, and then also really great tools and tips for talking with parents. And so as you can see in the screenshot of the website, there's 4 modules. It's in English or Spanish as well. And these 4 modules go over why monitoring children's development is important, why you have a unique and important role in developmental monitoring, how to easily monitor each child's developmental milestones, and then it goes into talking about how you can best talk with parents about their child's development. So some other resources and trainings, you can always stay up to date with available resources and educational strategies through the Massachusetts Act Early website, as well as through joining the Mass Act Early Facebook page for any updates. These again are some Massachusetts resources, which you guys can all have access through downloading this presentation, but these are all Massachusetts specific resources, as well as this page from the American Academy of Pediatrics, including different resource links. about a child's development. And then again, some CDC resource links as well. And then these are my references, and any question, we can take some time for questions. And then if you have any follow-up questions also that you think about after this presentation ends, please reach out to Dr. Kate Barlow. She is our CDC Act Early Ambassador for Massachusetts and is always willing and open to answer or help with any questions you may have.